Greetings from my office here in Chisago City, Minnesota. For those that do not know me, I am Mark Shields, a Field Safety Associate with OECS. Today I'm going to discuss what is on everyone's minds as of late, which is the coronavirus disease. The goal of this presentation is to provide training and greater awareness on the coronavirus disease 2019 or COVID-19 in order to reduce the impact on businesses, workers, customers, and the public. This training is based on interim guidance issued from the Centers for Disease Control and OSHA to help prevent worker exposure. This guidance is advisory in nature and informational in content on what is currently known about COVID-19. Our federal, state, and local governments, along with public health authorities, are taking action to contain the COVID-19 outbreak. However, long-term success cannot be taken for granted. All sections of our society, including businesses, employers, and their workers, must play a role if we are to stop the spread of this disease. COVID-19 is an infectious respiratory disease caused by a newly discovered strain of coronavirus that was first identified in December 2019 during an investigation into an outbreak in Wuhan, China. It was declared a pandemic by the World Health Organization on March 11th and a national emergency on March 13th. As of March 31st, over 200 countries and territories around the world have reported cases of COVID-19. So who is at risk? Most individuals infected with COVID-19 will experience mild symptoms. However, older persons and persons with pre-existing medical conditions such as heart disease, cancer, or diabetes appear to develop more serious complications than others. According to the CDC, about 1 in every 5 people who catch it need hospital care. To date, there is no vaccine and no specific antiviral medicine to prevent and treat COVID-19. However, most individuals do recover with supportive care. The greatest risk of exposure to U.S. workers are occupations such as healthcare workers, waste management, or personnel who travel to areas where there are large outbreaks. U.S. workers and employers of workers unlikely to have occupational exposures to COVID-19, which is a majority of us in general industry, have the same exposure risk levels as the general public. However, employers and workers in operations where there is no specific exposure hazard should remain aware of the evolving outbreak situation. COVID-19 is mainly transmitted from person to person through contact with respiratory droplets when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Other people can catch COVID-19 by touching objects or surfaces that has the virus on it, then touching their eyes, nose, or mouth. According to the World Health Organization, studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. This may vary under different conditions, such as the type of surface, the temperature or humidity of the environment. The CDC believes at this time that symptoms of COVID-19 may appear in as few as 2 days or as long as 14 days after exposure to the virus. The 3 main symptoms of COVID-19 are fever, a dry, persistent cough, and shortness of breath. Some patients have had other symptoms, including muscle aches, headache, sore throat, or diarrhea. If you develop emergency warning signs such as difficulty breathing, persistent pain or pressure in the chest, and bluish lips or face, it is vital that you get medical attention immediately. Severe complications of the virus include pneumonia, multiple organ failure, and in some cases, death. Although there are some similarities between COVID-19 and other illnesses, such as the common cold, flu, and seasonal allergies, it is important to understand that the incubation period is quite different with COVID-19. The incubation period means the time between catching the virus and beginning to have symptoms of the disease. According to the WHO, the average time for symptom onset is commonly around 5 days. Therefore, an individual may not even know they have the virus until symptoms develop many days later, possibly infecting people they come in close contact with. People are thought to be most contagious when they are most symptomatic, meaning they are experiencing fever, cough, or shortness of breath. Some spread might be possible before people show symptoms. There have been reports of this type of asymmetric transmission with this new coronavirus, but this is also not thought to be the main way the virus spreads. Reducing the spread and lowering the impact in the workplace include activities in one or more of the following areas: observing and implementing basic infection prevention measures, identifying, isolating infected employees, and implementing additional workplace controls. Simply, the best way to prevent this illness is to avoid being exposed to the virus. These are the 6 basic infection prevention measures that are recommended by the CDC that should be observed by the general public and workers who do not have occupational exposure to COVID-19. I will touch on each of these measures in depth. Have you ever wondered just how easily germs spread? The following video may surprise you.
I've always thought if we could somehow just see the germs around us, everyone would be a lot more careful and we'd get sick way less. Unfortunately, that's still not possible. So I did the next best thing by running a day-long experiment in this 3rd grade classroom. I found this powder called glow germ, and just like real germs, when it's on your hands, you can't see it. But unlike real germs, if you turn a black light on, it becomes visible. But it transfers to things you've touched, so it provides a really good way to visualize exactly how germs spread. So before the kids arrived, as a control, I went around and noted any pre-existing spots in the room that fluoresced under the black light, and then it was go time. The kids, of course, had no idea what we were doing, and that the teacher had been secretly infected with the glowing powder. So she randomly shook the hands of 3 kids, but didn't touch any of the rest. And so with that, they just went about their normal day. At break, I did choose one random student, and he agreed to letting me put some of the powder on his hands too. And then 2 hours later at lunchtime, I checked the results. Remember, everything you see here started with just the teacher and 1 student having a little of that powder on their hands. And because my flashlight can only illuminate 1 spot at a time, I used Photoshop to better visualize our observations of where germs were left behind, including on the other kids.
Uh-oh, we're pretty hot over here. Oh, right here.
And they were actually pretty diligent about washing their hands. This was the desk of the kid that was infected. And what's crazy is that germs could live on a hard surface like this for up to 9 days. And so you can see how important it is to disinfect the things a sick person regularly touches. For example, this was the phone of the teacher in the experiment. Even if you wash your hands really often, if you immediately pull out your phone, a lot of those germs just go right back on your hands. Think about when the last time was that you cleaned your phone. My friend Joanna at the Wall Street Journal recently demonstrated you can clean your phone with an antibacterial wipe every day for at least a year, and it doesn't affect the oleophobic coating at all. And this hopefully gives you a better mental model of why it's really important to wash your hands or use hand sanitizer after being at places like this, or this, or this, or this. Cleaning commonly touched surfaces is important because even if a virus is spread through airborne transmission, those tiny droplets don't stay in the air for long. Then they land on surfaces waiting to be touched by our hands. Which raises an important point. The ultimate defense against catching a virus is just don't touch your face. Your eyes, nose, and mouth are like the single weak spot on the Death Star when it comes to viruses. That's the only way they can get in to infect you. But as you can see here, not touching your face is easier said than done. And before you think, yeah, well, that's just kids for you, this was what the teacher's face looked like at the end of the day, and she said she tried extra hard to remember not to touch her face. I found this result fascinating, so I put the powder on my own hands for a few hours, and I resisted the urge to touch my face so many times that I fully expected I was going to have a perfectly clean face and the moral high ground. And then this is what I saw. What the heck?
Clean your hands and clean them often is one of the most important activities a person can do to mitigate the spread of COVID-19 and any other illness. Wash your hands, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Be mindful anytime you touch a surface that has not been disinfected. When in doubt, wash your hands. Using soap and water is the most preferred method to wash your hands, doing so for at least 20 seconds. If soap and water is not available, use a sanitizer that contains at least 60% alcohol. Ensure you let it dry on your hands. A word of advice, and something I do, is keep a bottle of hand sanitizer in your car so you can clean your hands after you have been in a public place or filling up the gas in your car. And just like the video clearly pointed out, avoid touching your eyes, your nose, and your mouth, especially with unwashed hands. Are we washing our hands the right way? Here's an informational video that demonstrates the best way to do so.
Let's first put soap in the palm of our hands and then begin to rub in between like so. But as you see, there is no soap on the back of my hands, so I'm going to interlace my fingers palm to palm, and then I'm going to do the same technique on the back of my hands with each hand. And then you're going to take the back of your fingers to opposing palms with fingers interlocked. And then start rubbing your thumbs. And then you're going to take your fingertips, clasp the fingertips in the right hand in the left palm, and vice versa. Rub your wrist one last time to make sure your hands have been completely covered in soap. Thanks for watching.
Another prevention measure is following good respiratory etiquette. Respiratory droplets spread viruses anytime a person coughs or sneezes. By following good respiratory hygiene, you protect the people around you from viruses such as the cold, flu, and COVID-19. If you use a tissue, ensure you throw it in the trash and immediately wash your hands afterwards. If you are sick and are coughing or sneezing, maintain a 6-foot distance between yourself and other people. While it may be disappointing that most sporting events, festivals, and large gatherings have been canceled and our way of life have been disrupted with school and non-essential business closings, there is a public health reason for these measures. These measures help stop or slow the spread of disease, allowing the healthcare system to more readily care for patients over a period of time, often referred to as flattening the curve. Social distancing is deliberately increasing the physical space between people to avoid spreading the illness. Staying at least 6 feet away from other people lessens your chances of catching COVID-19. Be mindful of going to public places unless it is essential, such as getting groceries, medicines, or seeking medical care. Also limit exposure to those most vulnerable to COVID-19, such as older adults or individuals with pre-existing medical conditions. At work, explore flexible work sites and work hours to increase that physical distance among coworkers. Here is a good example of proper social distancing, maintaining that 6-foot safe distance from other people. Let's discuss the math behind social distancing. Studies show that there is a direct linear correlation between social exposure and the average number of people a sick person will infect. Scientists measure the intensity of an infectious disease by its reproduction number. It is estimated that a person with COVID-19 will infect 2.5 people. Taking into account the median incubation period of approximately 5 days when a person will experience symptoms and self-quarantine, here's how social distancing can control the spread of this disease. Reducing social exposure by 75%, only 2.5 people are infected on day 30 by that one sick individual. Reducing exposure by 50%, 15 people are infected on day 30. And if no social distancing measures are in place, over 400 people are infected in 30 days just by that one person who is sick. Another prevention measure is to maintain regular housekeeping practices by cleaning and disinfecting frequently touched surfaces. This includes doorknobs, tools, light switches, our cell phones, our keyboards, our workstations. Be especially mindful of objects you may share with other people. Just like your hands, if surfaces are visibly dirty, they should be cleaned with detergent or soap and water prior to disinfection. Most EPA-registered household disinfectants are effective, as well as making a simple bleach solution. If you are using a bleach solution, remember the 10-1-10 rule, meaning 10 parts water to 1 part bleach, letting it stay on the surface for approximately 10 minutes to ensure the germs are killed. And lastly, stay home if you are sick. Contact your supervisor before you come into work if you think you may be sick. If you start exhibiting the symptoms such as fever, cough, or shortness of breath, it is vital that you call ahead before visiting your doctor unless you have any of the emergency warning signs. The most important thing you can do is to separate yourself from other people, to include those in your home if possible. If you are sick or think you may have the virus, there are additional steps to take that can be referenced on the CDC's COVID-19 webpage. So, what should you do if you have been in close contact with someone who has tested positive for or suspected of having COVID-19? These are some recommendations from the South Dakota Department of Health that may assist employers and their workers in determining the best courses of action. Most situations will require self-quarantine and self-monitoring of symptoms or in combination with social distancing practices. Prompt identification and isolation of potentially infectious individuals is a critical step in protecting workers, customers, visitors, and others at the work site. As an employee, what are your responsibilities in reducing the spread of COVID-19 at the workplace? Again, first and foremost, it is critical you stay home and contact your supervisor if you develop symptoms, test positive, or have been exposed to others with symptoms and or a positive test for COVID-19. If you think you have been exposed, self-monitor for signs and symptoms of COVID-19. Remember that most individuals would not exhibit symptoms until 5 days on average from exposure. That is why adhering to social distancing measures is so vital. If you develop symptoms or test positive for COVID-19, utilize CDC's guidance on home isolation before returning to work. Your employer is responsible to isolate and send home employees who appear to have symptoms upon arrival to work or become sick during the day. Don't take it personal. Even if you think it may be another illness such as the flu or seasonal allergies, they are keeping you and everyone at the facility safe while reducing the impact on the business. If someone has tested positive for COVID-19, your employer will inform anyone who may have been exposed to that individual while maintaining confidentiality. Those individuals who may have been exposed to the sick employee should self-monitor for COVID-19 symptoms and take the appropriate action. Additional workplace controls include taking necessary precautions when traveling or conducting meetings and gatherings. It goes without saying that all non-essential travel should be discontinued if possible, especially in areas where there is a widespread outbreak of COVID-19. Before any travel, notify your supervisor and check the CDC's Travel Health Notices website for the latest guidance and recommendations. Take care when attending meetings and gatherings. Consider alternative means such as video conferencing or teleconferencing or holding meetings in open, well-ventilated spaces to increase the physical distance of at least 6 feet among employees if possible. Just know that some meetings and gatherings may simply have to be canceled or postponed if no alternate means are available. Always err on the side of caution, especially in this situation. If someone has been sick at the facility, follow the CDC's recommendations for enhanced cleaning and disinfection. The first step is to close off all areas used by that individual, open outside doors and windows to increase air circulation prior to cleaning, and then conduct a deliberate cleaning and disinfection, ensuring you are protecting yourself first with the proper PPE. While PPE can prevent some exposures, hand washing and social distancing practices are the most effective tools at minimizing exposure risk for the general public and workers who do not have occupational exposure to COVID-19. It is important to understand the differences between surgical masks and N95 respirators. A surgical mask or face mask is primarily used to protect others from the wearer's respiratory secretions, such as a sick person wearing it to prevent transmission to others. However, they do not provide a reliable level of protection from smaller airborne particles, such as respiratory droplets from an infected person with COVID-19. On the other hand, the N95 respirator filters out 95% of airborne particles and is highly effective in reducing the wearer's risk of inhaling these respiratory droplets. However, these masks are not recommended for the general public and should not be worn by healthy individuals. Nitrile or vinyl gloves are effective at providing a barrier between you and a potentially infected object or surface and protect your hands when cleaning and disinfecting surfaces. Some additional recommendations include using the building's ventilation system to increase the flow of outside air or the installation of high efficiency air filters, or avoiding the use of other people's phones, desks, other work tools, and equipment whenever possible. If necessary, conduct regular cleaning and disinfecting before use, as discussed previously, if you must share. Having disinfectant wipes or solution at multiple locations throughout the facility will promote good housekeeping practices. Just accept that every day brings new facts and guidance. It is important to keep up to date on COVID-19 by following the World Health Organization's CDC, federal, state, and local guidance. I will provide some of these resources at the end of this presentation. The outbreak of COVID-19 may be stressful for people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and your workplace stronger. These are some recommendations from the CDC to manage the anxiety associated with COVID-19. They include taking breaks from watching, reading, or listening to the news stories. Hearing about the pandemic repeatedly can be upsetting. Use reputable sources versus speculation or rumors. Connect with and talk about your concerns with others. Maintain a healthy diet and exercise routine. Make time to unwind. Try to do some activities you enjoy. With enhanced social distancing measures in place, it is a good idea to take a break and spend some time outdoors. The weather is getting a lot nicer. Just know that there are local national hotlines and worm lines available for those who are in need of immediate support. Although much of the focus is on the number infected and deaths worldwide, it is also important to pay attention to those that have recovered. A high percentage do. Here are some additional resources that will keep you up to date on preventive measures to mitigate exposure to COVID-19 at home and at the workplace. OECS has developed a COVID-19 Help Center as a go-to for information, guidance, and best practices. We will be regularly adding new items to this site. Along with the CDC, your state's Department of Health websites are the most reputable sources of information in dealing with the ongoing pandemic. We can all prevent and slow the spread of COVID-19 by responding in a proactive and flexible way, as was discussed throughout this presentation. If we can respect the seriousness of the situation and not let panic or fear drive our emotions and actions, we will all navigate these uncertain times in the most productive and positive way possible. Thank you for your time, and as always, stay safe and take care of each other.